Good morning, everyone. Yesterday, it was announced that Ontario has confirmed 2 cases of the Omicron variant of COVID-19. Both cases were reported in individuals in Ottawa with recent travel from Nigeria. Ottawa Public Health is working diligently on conducting case and contact management, and both individuals are in isolation. I want to reassure Ontarians that we are prepared and ready to respond to this or any other new variant. The Ontario COVID-19 Genomic Network is continuing to actively monitor for all potential variants circulating in the province, including the Omicron variant, and it is conducting genomic sequencing on 100% of eligible COVID-19 positive samples in Ontario. We also have the infrastructure in place to manage outbreaks, including high volume capacity for testing, with 230 assessment centers and community labs and over 500 pharmacies offering testing to those who need it. In order to rapidly identify and trace and isolate COVID-19 and its variants, we have already expanded eligibility for provincially funded COVID-19 PCR testing at all testing centers to individuals who have returned from or traveled in the following locations between November 1st and December 6th, 2021. South Africa, Botswana, Lesotho, Eswatini, Mozambique, Namibia, and Zimbabwe. Asymptomatic family members and other household contacts of travelers are also eligible for testing. This list of travel locations may be updated as we learn more about the new variant and risk globally. Anyone experiencing symptoms of COVID-19, even if they are mild, is strongly recommended to get testing. And achieving the highest vaccination rates possible remains the key to reducing the risk of COVID-19 transmission and significant surges in cases. Please, if you are eligible for a booster dose, book your appointment today or provide yourself with an extra layer of protection. And if you have not yet received the vaccine, please do so as soon as possible. This includes vaccination for children aged 5 to 11. I also continue to urge all Ontarians to remain vigilant and continue following the public health measures and workplace safety measures that have been working for all of us and helped us get through the last 20 months. However, we will continue to monitor trends in key public health and health system indicators, monitor for and learn about this new variant, and we will act quickly in partnership with our federal colleagues if necessary. We continue to be in constant contact with the Public Health Agency of Canada and other jurisdictions to monitor the developing situation and ensure coordinated, effective, and shared efforts to protect the public. I know that this news of the variant feels concerning, but vaccination in combination with public health and individual protective measures has been working to reduce the spread of COVID-19 and its variants in our communities. So please keep up this great work that has got us to this point in the pandemic. We will continue to keep you updated in the coming days and weeks as we learn more about Omicron. Thank you, and I'm happy to take questions.
We'll go to the phone lines for questions. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Randy Rath with CHCH-TV. Please go ahead.
Well, hi, Doctor. Thanks for taking my question. I'm wondering, we have some significant steps taking place tomorrow on the COVID front, that the PCR tests will no longer be needed to cross the land border, and the John C. Munro Airport in Hamilton is starting to accept international flights again. Should those moves go ahead, in your opinion, or should they be held back?
Yeah, so we'll have to be reviewing this with our federal partners. We were certainly in contact with them all weekend to talk about a testing strategy for all travelers returning to Canada. We will further review the testing strategy for the short-term travel for 72 hours or less. We'll certainly have to monitor the situation in the United States. I believe the President of the United States will be making an announcement this morning. So you're absolutely right. It's a fluid situation. Most of this is a federal responsibility, but we're at the table voicing any concern by the Ontario government to ensure that we're listened to. But it clearly is a complete federal responsibility on international flights arriving into Canada. As you realize, this is a rapidly changing environment. Lots of questions yet about this new strain that we have to have answers for. We need to understand really if this is a virulent infection, if it makes people significantly sick or leads them to hospitalization. We really don't have that information yet. So I could understand in an abundance of caution putting some measures in play like we've done already, and whether as we get more and more information we put further public health measures in play. I can assure you we'll work with our federal partners to do that.
Okay, and as a follow-up, do we know where these cases in Ottawa came into the country? Did they come to Pearson and then travel to Ottawa, or did they land in Ottawa? Do we know that?
So I don't want to give any identifiable information away, but they did arrive into Montreal. Their testing was initially done in Montreal, and we received the results through partnership with the province of Quebec and the National Medical Lab and the Public Health Agency of Canada. These cases are being monitored very closely by both Public Health Agency of Canada and now Ottawa Public Health, that they've had a positive result. I have great confidence in Ottawa Public Health's case and contact management capacity, and we've been in regular contact with them over the weekend as we do case investigation and monitor these cases. We are investigating other cases, so I would not be surprised if we find more in Ontario, because we've got a very robust surveillance system, a great testing capacity, and as you've heard, our whole genome sequencing capacity in Ontario to do 100% of all positive tests, I think is just brilliant. So I think all Ontarians should be assured we've got good testing, surveillance, whole genome sequencing capacity, and because of that, we will continue to find cases and further protect Ontarians through local public health agencies doing that great day-to-day work of case and contact management.
Your next question comes from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, Dr. Moore. I wanted to ask about, I guess, the regional first approach to reintroducing public health restrictions that the province has been sticking to at this point. Like with the variant being in the province, so much we don't know about it, and cases going up already. Is that something you would reconsider the approach in terms of, it might be time to reintroduce province-wide restrictions?
Well, we'll certainly keep an eye on all of the data. Right now, we're working with just a couple of health units on further investigation of returning travelers. We've been informed by the Public Health Agency of Canada that we have 375 individuals that have met the case definition of returning in the last 2 weeks from those 7 countries. So all of our local public health agencies are working closely with the Public Health Agency of Canada to contact those individuals, get them tested, and if they're positive, we have good local capacity to respond to them. If we see widespread presence of Omicron across Ontario, which is not the case at present, then we could review any measures that we need to take at a provincial level, as well as certainly work with our public health agency colleagues about limiting the number of international flights potentially to 1 or 2 airports where we could have concentrated testing and assessment capacity.
Follow-up?
Holly, do you have a follow-up?
Sorry, I was on mute. I was just wondering about the travel, kind of targeted flight restrictions that are looking at specific countries. So, now that the variant's been detected around the world, and as you said, we'll probably see more of it in Ontario, do you see a benefit from a science public health perspective to only be investigating certain countries, or is there a better way to handle this?
I think we're learning from the epidemiology of this that it is this virus has been present on the globe for probably many weeks, if not months, and it has spread to multiple locations around the globe, as we're learning every minute of every hour, and it may be more prudent to broaden the testing of all returning travelers to ensure that they can have a take-home PCR test to get that test done and have the results tested for this strain in particular and or the Delta, which is the dominant strain here. So we're working with our federal partners on an enhanced testing strategy. Clearly that's within their domain at the federal airports for returning travelers, but that is one suggestion that we're offering to them, is to expand the testing beyond those 7 countries. We were fortunate to pick up these 2 cases from Nigeria, given that it was part of a random testing strategy, I believe. I would want to have that expanded to a larger proportion of returning travelers, if not targeted to regions of the globe where we're seeing a higher incidence of the Omicron variant.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Doctor. Does this mean that you need to look at accelerating boosters, considering that some of the protocols for COVID are, trying to get out ahead of things in a precautionary measure, in a precautionary way?
Well, very good question, Rob. We really have to focus in Ontario right now. 99-point-something% of all strains are of the Delta variant, and we know the vaccine is very effective against the Delta variant, and we are reviewing any measures we have to take to further prevent Ontarians. We will be making reviewing options and providing them to government in the next few days, and I would anticipate an announcement by the end of this week on an enhanced strategy to best protect Ontarians. We have to take into consideration the global epidemic and threats. But to be clear, we don't know the effectiveness of this vaccine against the Omicron variant. But you're seeing daily increase in cases, a slight uptake in the number of cases in the intensive care unit in Ontario, and we should remain focused on the present threat, which is Delta. We know the vaccine's very effective. We know 2 doses prevents admission to hospital at a very protective rate in the mid-90s. And the 3rd dose would only continue to protect Ontarians. So that is absolutely one strategy we'll be reviewing and presenting to government this week. You can anticipate potential acceleration of our 3rd dose strategy.
Follow-up.
Thanks, Doctor. And I just wondered if you could go over what some of the other options are then, so that people can be aware of what might be coming.
So with Omicron, we're clearly dependent upon the excellent researchers, the scientists, public health officials in Africa, South Africa in particular, that identified this strain just on November 9th. So this is rapid sharing of information across the globe, and have to thank them for that. We need further information on how well our vaccine works against this strain. We need further information on how well some of the monoclonal antibodies, so some of the therapeutics we have, would work against it. We also need more information on the severity of this virus in terms of its ability to cause severe illness and hospitalization or intensive care unit requirements. All of that information is getting gathered as we speak. We also want to know if the oral antivirals that may be coming soon and available in Ontario would work effectively against that. So the body of science is getting worked on aggressively over the next 2 weeks, and we'll have further clarity on what measures Ontario would need to put in place to best protect. In an abundance of caution, though, we really do need enhanced testing of returning travelers. We're pushing that from the Government of Ontario's perspective, and have testing capacity in Ontario if the federal government mandates enhanced testing to get the situational awareness that we need to best protect Ontarians. But going back to the basics, keeping your social gatherings small, keeping your masks on, your hands clean and washed regularly, physical distancing, all of those measures will work against Omicron and are effective against Delta, plus vaccination. So all of those basics, let's stay with them. We'll keep calm. We'll continue wearing our masks and doing all the basic actions that we know work against COVID-19 until we get further information on this virus, which we anticipate in the coming weeks.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Good morning, Doctor. The current public health measures in Ontario aren't really containing Delta. The cases continue to grow. We're now at the highest level of active cases we've had in months as of today's data. Previous, actually more stringent public health measures didn't do a great job of containing the Alpha variant earlier this year. If this new variant becomes more entrenched, even if it's not as harmful as previous variants, it does seem to be more transmissible. Are we not, by definition, looking at a new round of stricter public health measures than we see in the province?
Good question. Number one, we're seeing a lot of transmission in social networks, and there's a lot Ontarians can do to decrease the number of social contacts that they have. We're seeing a lot of transmission in younger children, and I'm happy to announce for the 5 to 11-year-old age group, as of this morning, we have 6.4% of them protected with their first doses. We've immunized 68,722 children from 5 to 11. Which is a brilliant initiation for this strategy. I hope that volume of individuals continues, so they're best protected going into the holidays times when we can anticipate seeing more cases. The good news in all of this is that the impact on our hospital system is manageable at this point. We have intensive care unit capacity. We're watching those numbers like a hawk. But the length of stay for these individuals in the intensive care unit is getting shorter. There are younger people now in the intensive care unit, sadly, that were not vaccinated for the most part, but their recovery seems to be quicker and their mortality seems to be less. So at the present volume of cases that we have, I would love to see them less and more people vaccinated, but we're doing relatively well. We're less than the national average. We're less than most highly populated provinces. So I have to thank Ontarians for continuing to come forward to get your first, second, or third dose, to continue the measures that you're taking within your social networks and in the workplace. And when you're in transit, those are working for us. And have to acknowledge this is a nasty, formidable foe. It wants to spread as we go indoors. We knew that. But I thank Ontarians that we're able to limit the impact on our hospital sector at present, and we'll have to continue to monitor that. When we saw Delta take over to be a dominant strain, it was a 3 to 4 month transition. We will have to see if we can limit the rapidity of spread of Omicron, as well as attenuate or limit its ability to spread in our communities by best adherence to these public health measures. It may be a 2 to 3 month transition if it's more effective than Delta, and we'll have to put in the precautions that are necessary. I don't foresee us having to take any steps back at present. We will, though, need to completely understand if it's more virulent, if it increases the risk for hospitalization. Because if we go back to our pandemic plan has been to minimize the impact, the morbidity and mortality of this strain of viruses on our society and minimize the mental, physical, social, economic disruption. If it's a less lethal virus, less impact on the hospital sector, and our vaccines can continue to work against it, we will continue our current strategy and not have to have any further public health restrictions. I don't have a complete crystal ball, but we'll have greater clarity in the coming weeks of how, as a province, we would have to respond to this new threat. I do want us all to remain calm, remain science-driven, evidence-informed, and follow the epidemiology of this virus.
Follow-up?
You mentioned impact on the hospital sector. Of course, that's been a crucial variable throughout the pandemic, but there are still more than 350,000 adults 50 and over who have not had a first dose. Even if this variant is no more virulent than prior variants. It's just more transmissible. We're still talking about potentially it could spread more rapidly through these people who are still unvaccinated. That could put pressure on the hospital system. Is there anything that you are looking at? We already have vaccine certificates. We already, control people, unvaccinated people's access to various amenities. Is there anything else you are looking at? Anything that is, any potential policies that are in a drawer somewhere in terms of encouraging that last 5 to 10% of people to get their first doses?
Well, yeah, another great question. Thank you for it. We're looking at additional therapeutics that could be helpful for these individuals that won't get vaccinated. We're also looking at newer vaccines. So the Novavax vaccine, we believe, is getting reviewed by Health Canada. That is not an mRNA or a viral vector vaccine. It's more of a traditional vaccine. We think that might be appealing to a certain percentage of the population that haven't been vaccinated to date. That is a very effective vaccine as well from the preliminary randomized controlled trials. We're also looking at expanding the ability to treat individuals who are unvaccinated with monoclonal antibodies. That they're very effective at limiting the hospitalization and or health system impact. We're also in active conversation to review with our federal counterparts the Merck oral antiviral and the Pfizer oral antiviral. These could help further protect our health system, help reduce the impact of this virus on those that remain unvaccinated, and be important options. And we're working very diligently to have a system in place across Ontario that these therapies could be available as soon as an unvaccinated person is tested to be positive. They could be offered after a clinical assessment. So we're working with our hospital partners, our primary care partners, the pharmacy partners, to ensure that all of those therapeutics would be available and minimize the impact. And we're anticipating somewhere in the first quarter, we hope in early January, to help have some of these tools available at a wide population level basis for those remaining individuals if they do come down with COVID-19. So that alone should protect those individuals and minimize the health system impact. We're not looking at further public health measures or mandates. We're looking at being able to provide the right care at the right time to the right individuals with good therapies that we know will reduce the impact on the individual, but also on the health system.
Last question.
Your final question comes from Linda Ward with CBC News. Please go ahead.
Hi, good morning, Doctor. You mentioned that you were investigating other potential cases of this variant. I'm wondering if you can tell me just how many other possible cases you're looking at and if you have a breakdown by public health unit.
We have 4 other individuals that we're waiting for whole genome sequencing results back. 2 are in Ottawa, 2 in the Hamilton area. Their local public health agencies have been working, were informed by Public Health Agency of Canada, have been informed and are doing active case and contact management. We are also trying to do our assurance that the 375 returning travelers from those 7 countries have been contacted and followed up and tested through the Federal Quarantine Act, which is mandating quarantine and mandating testing. So we are in discussions as we speak with our federal counterparts to make sure that those options have been provided and that we get appropriate testing results back in the hands of our local public health agencies to be able to respond if we have more cases. So to me, the system's working. The partnership with our federal colleagues who put in play the Federal Quarantine Act is working, as well as the random testing that has been put in play for returning travelers outside of those 7 countries. We would just like to see it expanded and a more robust testing strategy for returning travelers beyond the 72 hours.
Follow up, and this is the last question.
I'm just hoping you can expand a little bit more on that in the process of finding Omicron in Ontario. So in the past, hearing about the federal government sharing, plain manifests with local public health authorities who then go back over the last 2 weeks of test results and look for a specific variant. So just step by step, what's the process for doing that, for tracking this variant down?
Yeah, so the federal government looked at the Can Arrive app. They looked for any individuals returning from those designated countries that they ascertained to be the risk countries. Then they shared that information with the provinces. We were given the list that the federal government is investigating, and we will continue to work with them to ensure that all of the individuals have been contacted and tested, and that those individuals are given their results, as well as the respective local public health agency. If there is a positive test of the Omicron or Delta, those individuals, we would inform the federal government. The federal government would investigate the flight manifests and do risk communication to the individuals on the respective airplanes. The federal government responsibility is also to inform the World Health Organization that the Omicron has been detected within Canada, and we work with them to provide the appropriate information to the World Health Organization and the government of Nigeria, where the destination was for 2 of these cases. So it is complex. It involves international, national, provincial, and local partnerships, but from my vantage point, it's working, and it has worked all weekend in a seamless fashion. We just want to assure those 375 are contacted, are offered and provided the testing at a local testing center, and that we can give them their results and protect further the Ontarians against any potential spread at present.
Thanks, everyone.